Hi, this is Dr. Mitchell, and we are shooting this video to help you understand and prepare for what things might look like when you come to the office. With the ongoing COVID-19 pandemic, obviously things are a bit different, and we have changed some of our policies and protocols in the way that we schedule patients and also the attire that we wear to make sure that you, our patients, as well as our staff and our physicians are safe and we minimize any risk of sharing germs or illness at this critical time. And so to begin with, you'll notice when you come into the office that we're going to be wearing masks. All of the staff are going to be wearing masks. And then any staff or physician who is interacting with your child will also be wearing eye protection and also gloves. Now for the purpose of this video, I'm going to go ahead and take these off to make things a little easier for us to communicate. But want to make sure that you're aware that again, things will look different and we are going to be adding some extra layers of protection. You might even see some of the doctors wearing scrubs, which is not typical for most of us. And you might even see me in a white coat like this as we work to make sure that we just keep everything as clean and sanitary as possible. Another thing that you might notice are empty waiting rooms. So when you come into the office, you are going to see that we've dramatically reduced the number of patients that are in the office at any given time. And this is because we're doing our part to promote social distancing. Certainly caring for children is still essential, making sure that we get kids vaccinated, that we're here for you in managing asthma and toilet training and feeding issues and ADHD, all of those things that you come to us for assistance for. We're going to continue to assist you with that. A lot of that's going to be virtually, but some of that's going to be here in the office during your well visits. And so what we want to do is create an environment that is safe and free of congestion for you. And so we've done that a few ways. One is that we're going to have less doctors in the office each day. Therefore, that reduces the number of patients that we bring in. We are also going to limit each doctor to one patient per 30-minute interval. Again, making sure we've got plenty of time to get people in and out of the office so that we minimize any congestion. We are also requiring that for all visits, there only be one parent or one adult per child who comes for the visit. We're not allowing any siblings to come for those visits, and the exception would be for newborn follow-ups or for 2-week visits. Then we're going to allow 2 parents to come for those visits. Otherwise, just one parent, again, so that we can minimize the number of people in the office. We can minimize any opportunity for congestion and therefore minimize any opportunity for spread of any germs or illness. You'll also notice that as you check out, there won't be anybody sitting at that checkout desk. We're going to have you just go ahead and leave the office. We're going to do an expedited checkout, as sometimes that checkout area can get a little congested. And so we'll give you a call and make sure that we have everything taken care of, get those follow-up visits scheduled, but we'll do it by phone. So once you're done with your visit, you're welcome to just head out the designated exit. Another thing that you may see or you may not see, will be our enhanced cleaning protocols. So we have always cleaned rooms in between patients, but we're doing even an enhanced job of that and more frequent job of that throughout the entire office. So you may see people walking around with disinfectant wipes. You may even smell some of that disinfectant material. But again, that's for the purpose of making sure that we have a clean and safe environment when you do come here to the office. Something you will not see in the office are any sick kids or any sick people. To make sure that this is a safe place for all those well visits that are coming, we are limiting access to the office to only those who are healthy and free of any contagious symptoms. That includes our staff and our physicians, which are getting twice a day temperature checks, and any physician or staff that has a cough is not allowed to come into the office. You'll also notice as you come into the office, there will be a screener at the front door verifying that everybody is fever-free and verifying that any person coming into the office is free of cough as well. For those patients who are sick, we are still here to care for you. We will have virtual visits available. We will just make sure that we don't bring you into the office at a time when other people might be around who might get a potentially contagious illness. As we do those virtual visits, the physician on the virtual visit will assess your child and determine if there's any additional interventions or tests or examinations that need to be done. If that needs to happen, then that physician will facilitate that exam or that test for you and make sure that it happens. If your child needs to be seen, if your child needs a test of any kind, we'll make it happen, but we are going to really severely restrict any access to the clinic. And so if that child comes to the clinic, it will be after everybody is already gone, or we have set up in our Frisco and Mesquite locations drive-by capabilities where you can drive through and get an exam or get a test done. But again, that's going to be at the doctor's discretion and doctor's direction, so you'll need to have a scheduled time before you can come by and do that. Now, what do we need from you? Well, really, when you come to the office, we need you to wear some kind of face mask or face covering. We need you to do your part to minimize spread of any illness, even for those people who are asymptomatic. And so we're going to be wearing masks. We ask that you wear a mask when you come in. We also ask that you respect our rules requiring just one parent per child who comes in and no siblings. We know that's can be inconvenient, but we need your help to make sure that we limit congestion in the office and we make this a safe place so that our kids who need those well visits, that they can come in and feel confident they can come in and have a minimum exposure to other persons or other people. That also means that we ask when you're in the office, be respectful of that person in front of you. If you happen to show up at the same time as somebody else, we're going to try to schedule that so that doesn't happen. But maintain that 6-foot distance when you're in the hallways, when you're in the parking lot, when you're out and about living your life, so that we can do our part to flatten the curve and get through this pandemic as quickly as possible. One last thing that we're asking our families to do prior to coming into the office, please make sure that you give us a call or that you answer the call when we call you to verify your insurance. And if you're coming for a well visit, make sure that you've completed those developmental questionnaires and developmental screening questions prior to coming in. That's one of the ways that we can minimize your time here in the office and make sure that we get you in, get you out with minimal exposure to other people. We thank you so much for the opportunity to care for your kids. It is our great pleasure and our honor to do that. And we're happy to be here for you in this time of need and crisis in our community. But we're here, we're happy to take care of you, but we're gonna make sure we do it in a safe way, and we appreciate your help doing that. Take care and be safe.